Okay. Any questions about the equipment? Sure.
So, where would they get equipment?
Once they're done with our program, then they have to be retested by the state of Delaware. Once they have restrictions on their driver's license for the equipment, then we can give them the information to have the equipment installed. There are 2 places in Newcastle that do it. If they're in way southern Delaware, there's a place in Fruitland, Maryland that does it. You're probably going to ask me next, what are the approximate costs? A spinner knob, it sounds crazy because I know you can buy them at Pep Boys, but they're not the same quality. A spinner knob is about 100 to 150 installed, but let me promise you that the quality of a spinner knob that's installed by one of these guys is not the same as the ones you would put on your lawnmower from Pep Boys. Hang on one second. The turn signal extension is about the same. It's 100 to 150 depending on the person, and that is installed. The 2 of those installed takes maybe about a half an hour. A left foot accelerator is about, I'm hearing anywhere from 400 to 700. The liability for those have gone way up, and it's not so much the person driving or that has been trained to use the left foot accelerator. It's people forgetting to take them out, and then their spouse, their friend, their mechanic gets in, drives the car, crashes the car, goes through the front of a building, whatever. So the liability has gone way up. In fact, there's a lot of companies in New Jersey and Pennsylvania. There's a whole group of them that won't even install them anymore. They've made it a company-wide policy. Luckily, in Delaware, we've still got a few that will do it.
And what about the financial assistance? Does insurance cover it?
Insurance does not cover this. Medical insurance does not see driving as something that's medically necessary. If someone is trying to get back to work, there is the Division of Vocational Rehab, and they do help fund the driving evaluation and or training and or equipment if needed, if they're trying to get back to some type of employment, even if it's part-time. But the evaluation is not based on financial need. The training and equipment is. And honestly, I stay out of that. That is between the client and DVR. I don't know what their guidelines are. I don't know what their income cutoff is. I pretty much stay out of that. The other time when it might be paid for by an outside source, and this isn't typically a stroke, but is if somebody's involved in a car accident or a work-related accident. And I forgot one other is the VA, but that's typically not a stroke client either. Yes?
Are there concerns with the steering knob interfering with, say, airbags?
No. I have had the unpleasant experience of an airbag going off. I wasn't the driver, I was the passenger, but my driver was using hand controls and a spinner knob. It didn't do anything to it. Yes?
If the patient has a prescription for like round-the-clock benzodiazepines or opioid medications, do you let them go for the screening?
Well, and maybe I didn't go over this well enough, but we do have a referral form that has to be filled out by their physician. And one of the questions on the form is, do you feel that this person is ready to participate in a driving evaluation? Are they on any medications that would prevent them from participating in a driving evaluation? If so, what? And they need to list it. If they're not telling us, we don't know. If it comes up in our interview, I'm certainly going to ask them about it. Have I taken people out? I'm sure I have. In 16 years, I'm sure it's happened. On a rare occasion, I know we've had people that were either high or drinking. Luckily, we caught it, and we stopped it very politely, very under the radar. But we said, I think you need to come back on another day. You're not quite at your best right now. We were just very polite and all that about it. But has it happened? I'm sure it's happened, unfortunately. But a lot of times doctors will say, this person's on opioids for pain management or whatever. They take them at night. They're very self-aware of, the side effects, blah, blah, blah. So that's usually what we get. But thank you. Anything else? Sure. They can just reach over with their left. I mean, there are pieces of equipment out there. The question was, if you have a right hemi, how do they shift? They can just reach over with their left. There are pieces of equipment out there that they can use, but quite frankly, if they can just reach over, I'm not one who likes to recommend a lot of unnecessary equipment. It just adds more cost at the end, and if they can easily do it with their left, because most gear shifts are now either up on the dash or in the middle. Very few are column shifts anymore. Of course, I have the one car that is column shift because it's 2009. But yeah, most people can handle it, and that's fine because you're stopped when you're doing it. It's not like you're moving when you're shifting. So obviously, all cars have to be automatics. They can't be doing this with a standard. But good question. There are things out there, and for higher level disabilities, quads, people with muscular dystrophy, stuff like that, we have either push button shifts where they can just do it with their finger. We have ones that are voice activated, or for people who can't talk, they can do it with, like, there's this is the stuff I don't really get into, but there's, like, you tap it 3 times with your head, and there's I'm not saying this right, touch pads in their head rest, and if they tap it twice, that means put it in drive. They tap it 3 times, it turns on the left signal. It's crazy what it can do. Those are the people I'm not too thrilled to work with. That's why my boss does the high-tech vans, and I don't. But I like the lower-tech stuff. But, yeah, there's all kinds of crazy stuff out there, but it's electronic. Electronic stuff breaks down. I like to deal with the more mechanical things. They don't typically break down. Yes, they need maintenance, but I like to stay as low-tech and as low equipment as possible. I don't want to recommend a whole bunch of stuff that they don't necessarily need. If they can do it, and people who need hand controls, they could use that turn signal crossover. They don't need it. Most of them don't need it. They can just turn on their turn signals and put their hand back on the hand control. So that used to be a thing 10 years ago, where a lot of people were prescribing the turn signal crossover. We've all pretty much gotten away from that. Some places probably still recommend it, but again, it's another $150 they have to spend for something they really don't need and they can do safely. So I try to be as low tech and low cost as possible. Yes?
How much is your driving evaluation cost?
We have 2 prices. If you're 65 or above, it's $280. And if you are under 65, it's $320. We're one of the few in the area that offer a senior discount. Yes?
Are there any differences for your clients in the state of Maryland versus Delaware? Regulations?
Not really. I can say dealing with Maryland DMV, or however you call them, they are quite the process to deal with. When someone needs equipment and we need to go through that whole process, I tell people the minute I talk to them on the phone, let alone meet them, I say, you know what, go to motor vehicle now and get the process rolling, because I've seen it take as long as 6 to 9 months from start to finish, from when they first contact them to when we can actually take them for a road test because they need special equipment. So if I talk to somebody and I know they're going to need equipment to drive, I say get the process rolling, because it's like 10 forms filled out between them, their doctor, me, the whole gamut. So we got to get that process rolling. Delaware is nowhere even close. They're so much quicker, which is great. Any other questions? Yeah.
What's the time frame for the program? Is there a waiting list? And after you get the referral, how many sessions on average do you do?
There is a bit of a wait right now. We are backed up. The summer always brings out everybody from the woodwork. If I was to schedule someone right now in Wilmington, I'm looking in December. And yes, I realize this is October 15th. So I'm looking, I think, in mid-December right now. So about 2 months. But lately, that's kind of been our norm. We were down a person. We just hired somebody in June. So we're getting him up to speed. But he pretty much stays in the main office. I cover 5 sites. I'm only in Delaware once a week. And to answer your question, your second part of your question, depending on the equipment, depends how long it takes. Usually somebody who needs a spinner knob and a turn signal crossover, they can usually do it in 2 hours and then take the test. If somebody needs a left foot accelerator and a spinner knob, they might need 3 or 4 lessons and then take the test. It really, and I don't put people in a category. I really base it on the person, because I've had pilots who, because they're so used to doing everything with their hands, or forklift drivers or whatever, they take to hand controls like that. They can do it in 1 or 2 hours. We're supposed to say the minimum is 2 hours. I can honestly say I've done it in less. But those people are pretty amazing. Yep.
Former graduate of your course.
I thought you looked familiar.
A lot of my patients ask if the doctors are required to notify motor vehicles that they have stroke.
I was going to get to that, but since you brought it up, it is really the only thing a doctor is required to notify DMV about in the state of Delaware, to my knowledge, is seizures. That's the only required diagnosis. But, let's jump ahead. Anyone having concerns about a driver's ability can notify the state in writing. That means a therapist. That means a clinician, a doctor, nurse practitioner, whatever. A family member can also, if you have concerns about a loved one, you have to do it in writing, and I believe you cannot be anonymous. You do have to sign it. That doesn't mean that you will be thrown under the bus by DMV, that they will say, oh, so-and-so turned you in, but it means that it will stay on file, and they will say, okay, we have been notified that your driving privilege is under question, blah, 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 and then they generate. So, does that answer your question? I'm sorry. Okay. So I guess let me finish this one and then I'll jump back. So another way that the DMV can find out about you is that drivers are also asked for a self-evaluation at the time of application or renewal of their licensure. There's a question, and I forget exactly how it's worded. I can picture New Jersey's to a T, but it's something to the effect of, do you have a mental, physical, or convulsive disorder? It's something along those lines. I know that's how New Jersey reads because I live in New Jersey. But it's something along those lines when you're filling out your renewal for your driver's license. So that's whether you're getting a permit for the first time or whether you're getting a license renewed. And if you answer yes to that question, could it open a can of worms? Certainly. It doesn't mean you're going to lose your license. It just means they're going to ask you for more information. They might want some medical forms filled out by your doctor. They may ask you to be retested. There's a whole bunch of ifs there. But they are going to pursue that if you say yes to that question. So the state will review the report to determine if the case warrants evaluation by their medical advisory board, which may lead to requesting further medical information, periodical medical updates, which is usually yearly on your birthday. It usually comes around on your birthday. They like to do it that way. Specific license restrictions, which could be, say your vision is 20/50. That means you can no longer drive at night, but you can drive during the day. So they would put a restriction on there for daytime only. I'm trying to think if it was Delaware, but somebody puts dual mirrors. Have any of you seen a car that doesn't have dual mirrors? I have not. Not in this day and age. So I get a giggle out of that one because I've yet to see a car these days that doesn't have dual mirrors. Or if they needed special equipment, like I showed you before, they would put a restriction, and I can't remember the letters because they keep changing them, but it would be automatic transmission and special equipment. They may need retesting, so they may ask them to come in and prove that they are safe, go through their road tests like a new driver would, or possibly suspension of the driving privilege. So let me back up a minute. Okay, so what about cognition, visual impairments, and aphasia? Cognition, I told you how we assessed it. So if it comes up that it is an issue, Sometimes we can use compensatory strategies, repetition, put them in situations where they have to problem solve, make quick judgments. It's usually we have to give them training and put them in situations and see how they handle it. And it's kind of a repetitive thing. And usually those folks need at least 2, sometimes 6, sometimes 8. It really depends. I usually make my cutoff at 6. If they're not making progress by 6, especially if they're an experienced driver, they're probably not going to make it. If they are making progress around 6, okay. But hopefully by 8 or so, they're gonna have it. Because if they're, after, unless they haven't been driving in like 5 years, then a lot of times if they're not cutting the mustard by 6 hours, it's likely then that those deficits are not going to be retrainable and that they may have to retire from driving. Visual impairments. Yes, we do work with folks with neglects, homonymous hemianopsias. I'm missing one. Throw one out if you have one. I can't think right now. Huh?
I don't know if this isn't really a visual problem, but like a left inattention.
Thank you. Yep. Okay. So in this state, we are blessed to have a wonderful, and I said he was a neurooptometrist, and then I looked it up last night, and I figured out he wasn't, and I apologize for that. He is a optometrist specialist, is what his website said. Dr. Donald Blackburn, he's out of Wilmington. He has his own vision academy in the Wilmington area. He often refers to our program, and fortunately, when he refers to us, his folks have already been evaluated and trained. So when we get them, they're done. They're ready. They're good to go. So they may already have a prism on their glasses or embedded in their lens. They oftentimes are faithful and they have completed their home programs and they've completed all of their therapy with him. So, or they've worked with some of you out there for their OT vision training, which is great. So I have to say in Delaware, I am blessed. Most of the time, these folks are coming to me and they're ready to go. Very, very few times do I have to turn away a vision patient in the state of Delaware, unless it's a kid and they're maybe CP or something like that, and they've got vision issues, visual inattention, stuff like that, where they can't stay straight in their lane. There's all kinds of other issues going on. But usually if it's a stroke and they've gone to Dr. Blackburn, they're usually good to go. Aphasia. I always, and for the speech therapists in here who have these, thank you so much for giving them out. The aphasia card. If you don't know what an aphasia card is, it simply is a card that says, I have aphasia. It generally, in layman's terms, explains what aphasia is. And then on the back, it usually has a place where you can put a family or a loved one's phone number and name so that if they, God forbid, think if you weren't a healthcare professional and you got into a fender bender with somebody that has aphasia. You get out of the car. What's the first thing you're going to think of? They're drunk. Exactly. So if we weren't all health professionals, we're going to think that person's drunk. So imagine if, God forbid, somebody with aphasia gets into a fender bender, gets pulled over by the police, whatever the case might be. I want them all to have aphasia cards or something written in their wallet, even handwritten is fine, I don't care, saying what aphasia is, I've had a stroke, I've been treated, I've been evaluated, whatever the case might be, here's my wife's phone number, I might not be able to get the right words out, blah, blah, blah. You know the scenario. I think we did that. That's it. Thank you. Any questions? Sometimes, yeah. It depends on the person. It depends on the scenario. I definitely have done that. It usually doesn't go very well. But as people are getting more and more used to GPSs, of course, we usually set them up beforehand, and then I'll see how they can attend to someone talking to them, as well as trying to pay attention to everything that's going on in their environment, as well as this thing barking at you the whole time. But yes. Yes, we do.
Just real quick, what's your opinion on the DriveAble cognitive visual assessment? I don't know if you have experience with that.
Is that the one from AAA?
No, I think it's private, but it's all like visual scanning and memory.
I'll be honest, I don't have much experience. I have heard of it. I don't have much experience with it. It's something I probably should look into. Thank you. Yes?
In Delaware, as we all know, we go to school and we actually go through driving tech.
Right.
Driving certification.
Right.
Teachers. So my question is, do you have to have certifications in each state, or is it a specialty just for the OT?
Yes and yes. I'm an OT, and then I have a specialty certification just like a hand therapist would. I'm what they call a CDRS, so a Certified Driver Rehabilitation Specialist. So I went on to take some crappy test, just like a hand therapist does, to get those additional initials after my name. And then I am certified by the state of Delaware to be a driving instructor. I am certified by the state of Pennsylvania to be a driving instructor. I am on New Jersey's list. We are not certified by them, but we've been with them for so long, they don't really care. And Maryland has put us on their list as well. So we have relationships with all 4 states. Yeah.
You mentioned notifying the state if you have concerns about some of these driving tests, like there are specific departments that you send that.
The medical unit, which is down in Dover. But even if you I shouldn't say that. There is a medical unit in each DMV, which there's only 4 now. There's Wilmington, Delaware City, Dover, and Georgetown. If you went in and asked for, I'm trying to think of the name of it right now, and I can't, driver improvement. They have the medical unit in there. If you spoke to one of those officers, they're just DMV employees, they're pretty helpful, and they could guide you. But you would need at least the person's name, date of birth, driver's license number if possible, or at least the last 4 of their social.
All right, let's thank Lynne for her